The benefit to the American taxpayer is hands down the ability to look for very specific types of technologies to answer very unmet needs. Technologies that are not yet available, and making them more visible, giving them the ability to more quickly come to market because of the requirement that they be useful terrestrially, not just for NASA, but for a broad range of patients. So patients will benefit because these are technologies that might otherwise not be moved forward or take a lot longer to get to the marketplace and get to patients. So I think the broad base of the US actually benefits a lot from being able to move these technologies forward.
The SMARTCAP grant would be instrumental for our company. Not only does it provide the cachet that comes along with trying to do maybe what's going to be the greatest accomplishment of our generation and help somebody get to Mars, but it also gives us funding to understand some of the basic physiology and deepen our proof of concept studies to get our company off the ground and hopefully provide a real commercialized product to help the astronauts. Not only up on the International Space Station, but for terrestrial diseases like glaucoma or intracranial hypertension. We think that our technology, which basically allows you to change the eye pressure in the eye and set it to where you want it to be, can help equalize these pressures and treat the disease.
Our technology is actually pretty straightforward. It's basically a pair of goggles that's attached to a pump.
Okay.
And that allows us to change the pressure inside the goggle, which in turn changes the pressure inside the eye.
Mm-hmm.
So right now we've got it set up to vacuum, which would lower the eye pressure as a potential treatment for glaucoma.
Okay.
So as you can see, this is not a very refined prototype. This is one that I put together with kind of off-the-shelf products. But you put the goggles on, and now when you hold the pressure on, you can create a vacuum inside the pump, and this tells us how much vacuum we've created. So I've essentially lowered my eye pressure almost 25 millimeters of mercury just right now by doing this. Most medications will only lower it 5 to 10 millimeters of mercury. So one of the real nice advantages of this is if you watch that needle there, as I bleed off the pressure, I can set the pressure to be exactly what I want it to be. There's no other treatment that exists that allows me to control the pressure just the way that I want it. Now in space, what we would do is we'd add pressure to counteract the high CSF pressure, the high brain pressure that astronauts have.
Okay.
And so hopefully by equalizing those pressures, we can treat the condition, provide a countermeasure for our astronauts to be safer and more functional up in space. The astronauts have high CSF pressure, we believe, because gravity doesn't interact with it in space. So if you think about the brain and the spinal column, it's all bathed in this fluid. As you and I are standing here, that fluid drains down into the bottom because gravity pulls it there. In space, there's no gravity. It redistributes equally everywhere, meaning that at eye level it's higher than what it usually is. So if normal is like this, in space it's like this. And that high pressure over time causes that optic nerve to bow forward and cause problems. By raising the pressure on this side, we can cause it to equalize, is what we believe.
So is this an occasional treatment, or
I'm
something
hoping
you
that
permanently have to wear?
What we hope is that it's something that as long as you get it to equalize for a while and allow the metabolic needs to move back and forth okay, that you can wear it for a few hours at night.
There is no reason to not apply for this grant. The people are tremendous, they're smart, they've helped me, they've given me ideas, they've helped me have a better understanding of my business, and plus you get a chance to be a part of one of the biggest things that humanity's ever done.